Okay, is this better? Can? No echo? Can't really hear myself. Yes, hi guys. So now like there's no echo already, right? Everything is good. Okay, I'm so sorry for the delay. Hi.
Hi.
So sorry.
Sorry.
Hi.
Hello.
Oh, I think the
echo comes on
now when we are
now when we are talking.
Yeah, I think so.
Is it because you're
Is it because you're on speaker?
Yes.
Maybe that's why.
Maybe that's why.
I don't have a earpiece or anything with me though.
Oh, okay.
Okay.
Like
You
just talk, then I will just
try to be.
like
I'll just let you talk now.
Okay.
Okay.
And so
thanks
guys
guys for like coming to this live.
I think there's some
technical glitch
because of the
echo.
yeah, but then so like thanks
Dr. Ng for
taking the time out to join this live. So today Dr. will be
talking
about
about
diet,
the different diets,
as well as
when to identify like emergency.
Yeah, so maybe
So maybe Dr. talk about it.
Yeah. Okay. Thanks, Jane, for the introduction. So yeah, thank you for coming for the session today, everybody. So first of all, I would like to thank Hills and Wolf Agency for making this live session possible today. Okay. So today we'll be discussing on two topics where I'll be sharing with you some of the common queries that pet owners have on what to feed their pets. Because of the limited time that we have, we'll only be covering mainly on the sort of main type of diets that dogs and cats have, and hopefully by the end of this talk, we will all have a better idea what we can or cannot feed our pets. So first of all, let's start off with what we shouldn't feed or cannot feed our pets, because not all human food is actually safe for them. For easier reference, we actually made a little chart of what to not feed the dogs or cats, and have uploaded the poster onto both our clinics and the Hills Facebook page. So for those of you who are interested, you can have a look at our Facebook pages. Okay. So at our clinic, pets are often brought in for suspected ingestion of things like chocolate, grapes, raisins, or poisons like cockroach or insects, baits. An ingestion of any of these listed toxins in the chart can potentially be life-threatening to your pets. And so if you ever have any suspicion that your pets might have ingested any of these things, try to bring them to your vet as soon as possible so that we can provide the necessary treatment. Great. So on to the main topic of the day. What can we feed our dogs and cats? The list of options here is not exhaustive, but broadly covers what we would normally feed our pets. So of course, the most common and readily available options would be dry food or kibbles. Commercial dry food is very cost effective and convenient option for pet owners. It can be easily stored and typically has a very long shelf life. The one thing to note though is that a lot of pet owners will transfer the food into a Tupperware container for storage. This is usually not recommended because the pet food companies actually manufacture their pet food or store their pet food in such a way that the food is stored better. better when it's kept in its original or specific packaging. Also, if the container used to keep the pet food at home is not washed or cleaned regularly, then it may actually carry some harmful organisms that will spoil the food faster. So, for example, Hill's prescription diet, what they have introduced is that they've introduced this Velcro press lock seal on their packaging to ensure that the food is always kept fresh and contamination is minimized. Okay, the next main benefit of dry food is that most of them are actually complete and well balanced, which means they provide all the nutrition, vitamins, minerals, or everything that's necessary for your pet's growth without the need of you buying additional supplements or anything like that. One thing that I would encourage pet owners to check just before purchasing any commercial dry food is to always look for the AAFCO declaration or statement on the packaging. So I have an example here. So this is actually Hill's diet. If you look at the, I don't know if everybody can see it well enough, but on the packaging, it will usually state that it's got this AAFCO declaration or statement basically, and it basically means that this food has been has undergone trials and a lot of feeding trials, and it's deemed complete and well balanced and has been tested and proven to be adequate for the life stages that it's meant for basically. So yeah, so try to look for signs or declarations like this to say or to know that the food that you're feeding to your pet is complete. Okay, so moving on, there are some suggestions to say that pets that are on or the pros of dry food is that your pet may potentially have a better health, a dental health. Indeed, there's actually some evidence that kibbles can prevent the buildup of tartar on the teeth, but it's actually not the tartar that causes dental disease, but more of the plaque that causes dental disease. And the difference between the two basically is that the plaque it can sometimes be colorless, and it can be at the root of the teeth basically, and it shouldn't be, feeding dry food shouldn't be used as a substitution for teeth brushing and also sort of dental checkup with your vet basically. So we would still encourage you to come in for a check for any sort of dental health issues, or if you suspect your pet has got any sort of dental health issue. Okay, moving on, we talk about some disadvantages of kibbles. It can be less palatable in comparison to other types of food. A lot of cats in particular would prefer wet food as it smells and tastes a lot better. I haven't tried them myself, but it definitely does smell better. So we tend to feed more wet food option to hospitalized patients most of the time, as it smells a lot better. The other disadvantage of dry food is that it's got a high ash content and typically around the region of 10%. And ash basically just adds bulk to the feces and has got no benefits to the body whatsoever. Okay, so let's move on to canned or wet food. As mentioned earlier, it's a lot more palatable. And that being said, sometimes you have different pets that prefer different types of diet. So even though I mentioned earlier that hospitalized patients, sometimes we feed them wet food most of the time because it smells better, but there are patients that will just prefer dry food compared to wet food. The main benefit of wet food comes from its high moisture content and the fact that it's soft. So it makes it very suitable for patients with missing or no teeth at all, and also for patients with recurring bladder issues like cystitis. Wet food, however, will definitely cost more than dry food. For comparison purpose, only we To feed a 10 kg dog dry food per month, you would be looking at something somewhere around $60 to $80, and it will cost something around $150 to $180 per month to feed wet food actually. Okay, so next we'll be talking about prescription diets. So these are diets that basically get prescribed by your vet to target specific issues or conditions or diseases. So for example, if your dog has got things like pancreatitis, then your vet would actually recommend a low-fat diet. Okay, and another example is if your dog has got any skin or food allergies or something like that, then the vets would be recommending ZD diets. Okay, and these are prescription diets by Hills basically, and because all these prescription diets have undergone really intensive research and analysis and things like that to produce them, they are costly. And again, referring back to our 10 kg dog, it would cost you something around $100 on prescription diet, on dry prescription diet, and about $240 per month for the wet ones basically. Okay. Good. So next we'll talk a little bit about raw food. Okay, it's been talked a lot in the recent years, and according to studies done in 2017, up to 16% of dogs in Australia and the States and 10% of the cat population are fed raw food. And it's estimated that now the retail of raw food has increased by about 64%, and the figures are still climbing. So raw food comes in various forms, such as there are some that are completely raw, there are some that are gently or lightly cooked, there are some that are dehydrated, and there are some that are freeze-dried basically. And a lot of owners have elected now to feed raw-based diet due to the perceived health benefits, such as skin, dental, or gastrointestinal health. Or some believe that it's more natural or more of an ancestral diet to feed their dogs and cats. All these benefits have remained unproven, and scientific evidence is still lacking. So as of now, there's no scientific evidence to say or to prove that this feeding raw food will help with these things. Of course, we still hear many owners that are feeding raw food have benefited from feeding raw food. But then again, let's look at the cons of feeding any raw food diet. So they can be contaminated and potentially with harmful pathogens. And these pathogens can sometimes even pose as public health risk. This means that it can potentially pass from your pet to human or the other way around basically. So multiple studies have demonstrated that raw food can be contaminated with bacteria such as Salmonella, E. coli or Campylobacter, and it can go up to 80% of the raw food and commercially prepared diets. And in addition to all this potential infection risk, many of the commercial prepared raw food also comes with bone or even part of bone that can cause perforations of the intestinal tracts or the entire sort of gastrointestinal tracts coming down all the way from the mouth to the large intestines basically. And for those pets that do well with raw diets, or people or owners of that feel that their pets have been doing quite well with raw diets, then we would recommend you to regularly deworm your pets and also ensure that your feeding utensils, litter boxes are regularly cleaned and so that the risk of infection is kept to the minimal basically. And health risk is particularly high for family with immunocompromised people, with children, pregnant or even older folks at home. And of course, if you've decided to feed your pet raw food, then a consultation with a vet nutritionist will be highly recommended if you decide that's the best for your pets. Okay, good. So lastly, we'll talk about a bit on vegetarian and home cooked diet. So with vegetarian diet, it is possible with a dog, but not for cats because they are obligate carnivores, which means that they should be fed a high proportion of animal-based protein, especially to young kittens. So one of the amino acids that is really essential for growth, known as taurine, it's really important because a cat can actually develop dilated cardiomyopathy, which is a heart condition that is secondary to this type of amino acid deficiency. And so we would strongly recommend that feeding a well-balanced commercial diet to kittens and puppies to support growth, and only switch to a home cook or vegetarian diet when they've reached their adulthood. Should you feel more comfortable feeding a home cooked diet or a vegetarian diet? So with that being said, there's no one best diet for. There's nothing such as the best diet, but only the most suitable diet for your pet. So it can sometimes mean that you have to go about exploring the options out there and also finding out what is best or most suitable for your pets. Okay.
Good. I guess how do the pet owner know if the pet is doing well on the diet?
Yeah. So great. So we go by a few things. So the most important thing is that the body condition score of the patient or the animal is well maintained. This means that we grade them out of 5 or 9, depending on which scale we're using. And of course, we want them to be right in the middle. So either a 2.5, 3 out of 5, or a 4.5 or 5 out of 9, basically. Of course, when you do your annual checkups with your vets, then your vets would advise you that, whether or not the current diet is suitable in terms of the amount of food that you're feeding is suitable. If it's a puppy or a kitten, for example. The other thing is that the other thing to note is that a lot of pets can be having gastrointestinal signs like vomiting or diarrhea, regurgitation, or anything like that. Then we may, after a series of consultation and food trials and things like that, then we may decide whether or not the diet is suitable for your pets, basically.
Okay.
Another thing is that should I feed like wet food together with kibbles so that my cat get enough water in their system, or is it like big pets? Yeah, would it the balance?
No. So it's fine. It's fine to feed a mixture of dry and wet, or a combination of home cooked plus dry or wet in that manner. It's all fine. It's just that what we're trying to achieve with any sort of intake is so that we reach or we achieve the calorific intake or daily requirement of the pet. So one quick way to calculate calorific intake is to take the body weight of the pet times 30 plus 70. So that will give you the amount of kilocalories per day in terms of just maintenance. So obviously, if you have got a lactating dog or a dog that's doing a high level of activity, exercise, or things like that, then you would have to multiply that by another coefficient so that we achieve the daily requirements. But of course, then you can speak to your vet about how much is the right amount to feed. So in whatever that you've mentioned, so what we're trying to do is calculate the dry amount of calories in the dry, calories amount in the wet, and then as long as we achieve whatever is required for growth, then that's fine.
Okay.
Okay.
So there's also
Also,
um
someone.
so Esther
So
is
Esther is asking.
there has been
There has been
a lot of
a
hype
lot of hype
around
around grain-free food.
so
Yeah,
are
yeah.
So are grain-free fed
for dogs.
for dogs.
Yeah, so grain-free diet has been associated with, there was a statement released by FDA to say that there are certain types of grain-free diets that's been associated with dilated cardiomyopathy. There are some suggestions, but we don't know exactly whether or not there's a concrete link just yet. If the grain-free diets are proven to be associated, then of course we would advise otherwise. Yeah. At this moment, there are certain brands that are associated, but then again, yeah, without the concrete evidence, we can't say anything just yet. Yeah.
Okay,
Okay, I understand.
so I guess
I guess then when it comes to
kibbles, right?
people, right?
Like
Like other than the one that you were saying
earlier,
earlier,
the
Yeah.
the AAA, right?
Yes.
Yeah, so what
Yeah, so
are
what
the things
are
that
the things
we
that
look out
we
for
look out for
In
when
terms of
choosing
when
a
choosing
brand
a
of
brand of people?
It comes down a lot to what you are comfortable feeding. So there are kibbles that comes in various sizes to suit different needs of or different what the pet prefer. For example, some kibbles come in small or big bites that may be of preference of your pet, basically. Yeah. So there are many different options out there that you can consider. But the other thing that we sometimes advise owners is that try to look for kibbles that do one type of protein. Try to stick to one protein. This is just so that we will then be able to see whether or not your pet is sensitive to any component of the food, basically.
Okay,
Okay,
but I guess
I guess
a lot of
a
owners
lot of owners
also face
also
the
face the challenge
of picky
of
pets.
picky pets.
So
Yes.
So,
like
what do I do
if
my dog or my cat
gets bored very
gets bored very easily?
Yeah, so sometimes we have to rule out medical condition first and see whether or not it's due to a medical condition that causes the pet to not want to eat, or then then we will see whether or not it's actually because the pet is truly just picky, or then of course then we go down the option of trying different kinds of food, different presentation of food as well, mixing dry and wet, doing just wet, or trying other types of options out there. Yeah, so the important thing is actually to rule out medical condition first before we decide that the pet is just picky.
Okay.
Okay.
So I think there is someone asking, what do you think about
feeding,
which is
which is better,
kibble or
kibble or raw?
so I think you
So I think you
mentioned
mentioned it earlier
about raw
about raw
feeding
feeding,
that there's
that
no
there's
one
no
best
one
diet.
best diet.
Yeah, so there are people who feed raw diet, strictly only raw diet, that have seen improvement in terms of dental, in terms of gastrointestinal, in terms of growth or skin health and things like that. There are people who are like that. But advice from us is just that if you decide that raw feeding is for your pets, and again, if you want to go down feeding raw, then the best thing for you to do for your pet is ensure that handling of the feces of the pet is very careful, washing the utensils, making sure that you handle the food carefully, and this is of course for the safety of your pet and for yourself as well.
Okay.
Again, if it's suitable for your pet, then it may be an option, but it's just that you have to be aware of the risk of involved with feeding raw food.
Okay.
So I think
So I think there's also someone asking
Ruth
Ruth
saying
saying
whether
whether
feeding
if feeding
the dog
the
enough.
dog enough.
So twice a
So
day,
twice a day,
half a cup,
half a cup,
7 years old
7 years old Jack Russell.
So I think this is
So I think
around
this is
like
around like
how
how do you determine
if the diet
if the diet is nutritionally enough
for your dog?
for your dog?
Yeah. So we went through earlier the guideline to have is to calculate the amount of calorific intake. This means to say we take the body weight of the pet times multiply by 30 plus 70. That will give you a rough idea of how much kilocalories to feed in a day. And once you know the amount of kilocalories to feed in a day, most pet food will come with, okay, I just have an example here. Most pet food will just tell you how much kilocalories is in per kg of food, for example. So this one, for example, I don't know whether you guys can see, but it says something like 3,500 kilocalories per kg, for example. And then, of course, then you do the math, and then you will know how much grams, how much carbs to feed in a day. But of course, the most accurate way to look at whether or not you're feeding your pet enough is whether or not your pet is maintaining weight, whether or not he's got a good body condition score. Yeah.
Okay.
So
So
I think
so
I think there's someone asking
with the whole
with the
BCM
whole
issue
BCM
with
issue with dogs.
she has heard that
She has heard that AAF approved
foods
are not enough. Can you see the question?
I can see the question here. So the AAFCO and the WSABA guidelines are actually very good resources that you can actually look at in terms of selecting what is the better diet for your pet. While preparing for this, I had a look at the WSABA guidelines and also the guidelines coming from the AAFB CO as well. There isn't a best diet in that sense, but the important thing is selecting the appropriate or rather the more suitable diet for. I mean, you can be going for the best claim diet, but your pet may not do as well on it. So you still have to look for potential sort of side effects, food allergies, or anything like that with the current diet that you are feeding. There are recommended brands of diet that are listed on the website. You can of course have a look at them. These are diets that have undergone trials or feeding trials to say that they are suitable and they're adequate for your pet. It doesn't mean that it's gold standard, but it means that it's adequate in terms of nutrition.
Okay.
Okay.
So
So the other question is
switching up like
people
to different
to different brands, different proteins.
Is it
advisable?
Yeah, so that's fine. If you are thinking about changing diet, then we advise you to do a slow change over 5 to 7 days. So, for example, in the first day, diet A, diet B, you do a mixture of 80-20%, and then you go down to 70-30%, and then eventually, after 5 or 6 days, then you do a full switch.
Okay. How about freeze dry?
Sorry?
How about freeze
like Timothy asking
your thoughts around
your thoughts around that.
Yeah, so I had a look at freeze-dried diets. Basically, these are diets that are kept at low temperature, and so the thing that is still not how do we say, that's not completely free is contamination. And freeze-dried diets still carry the risk, even though it's done at very low temperature, it still carries the risk of contamination. And also, one of those parasites that can be in freeze-dried diets, even if it's at as low as negative 12 degrees Celsius, is toxoplasma. And toxoplasma can be one of those protozoa or parasites that can cause serious side effects or conditions in your pets.
Okay.
Okay.
So,
So, should we
talk about
emergencies?
Yeah, okay.
Okay.
Okay, good. So for the next 20 minutes or so, we'll talk about some emergency conditions that we see in pet clinics. This was the topic that was arranged while we had the circuit breaker period. So now we are opening up a little bit more, meaning the AVS and the NEA has lifted some of the restrictions on vet clinics on what we can see or what we can do in the clinics. So it will still be relevant in a sense, or maybe we can share about what to look out for in situations like an emergency. So of course, many of you, I'm sure you would know what consists of an emergency. For example, difficulty in breathing, any seizures, excessive or continuous vomiting, retching or continuous diarrhea, or blood in diarrhea and things like that. Of course, if you're out walking your dog under hot sun and things like that, heat stroke as well is one of those potential emergencies that we can be looking at. But just for the purpose of today, we will just briefly talk about 3 common emergencies that I hope that more pet owners will know about. So first of all, we talk about uterine infections such as known as Pyometra. This is a medical condition where acute or chronic infection of the uterine wall lining occurs to and cause accumulation of pus within the uterus itself. This happens in intact female dogs or cats. And studies have shown that nearly 1 out of 4 intact females will develop pyometra before they reach the age of 10. The time period that we want to be more careful of in terms of when they can develop pyometra is when it's about 1 or 3 months after the heat. So this is the time period or time frame that we want to be a bit more careful about. And common signs that are noted by owners on presentation would be things like smelly pus-like discharge coming out from the vagina of the pet, or continuous vomiting, lethargy, and things like that. And so the discharge is only possible when it's an open pyometra. So there are 2 different types of pyometra. It can be an open, it can be a closed pyometra. So when it's open, the cervix itself is open, but when it's closed, the cervix is closed and tightly closed, and it continues to accumulate in the uterus, and there will be no discharge coming out from the vulva. And these are the types of pyometra that can potentially be life-threatening. So as the uterus continues to build up with pus, our pets will start to feel very sick, and if not detected in time, then it can become septic. The pet can become septic, and it can also develop issues like acute kidney disease secondary to the pyometra. And of course, then with the buildup of pus, it can also potentially rupture and cause death, basically. So the best option in this case, both the ovaries and the uterus under anesthesia, which means basically we sterilize them. Okay, and this is definitely not a medical condition that should be taken lightly. And to prevent all this from happening, then we strongly recommend that you sterilize your pets early, basically. Another information to note is that early sterilization of our female pets before the second heat itself actually minimizes the risk of them getting breast cancer, and if we sterilize after that, then the percentage of mammary cancer goes up, basically. So do consider sterilizing the pets as well. Okay.
How about for male dogs?
Male dogs.
Or for males in general?
So for male dogs, I typically recommend sterilizing them before the age of 4. After the age of 4, most dogs will develop issues with the prostate, issues like benign prostatic hyperplasia, and some middle-aged dogs can develop issues like perineal hernias and things like that as well. So we will still recommend, but of course there's no best time as long as it's before age of 4. Okay, so the second emergency that that I'm going to talk about is when our pets repeatedly strain to urinate and is actually unable to pee. In such cases, never ever wait for more than 24 hours before bringing them to the vet, basically. Male cats and male dogs are more predisposed from getting urinary blockage because of the more narrow or the longer urethra that they have. And a blockage can be due to many different things. In dogs, the most common reason for blockage is actually due to bladder stones and things like that that's just getting stuck in the urethra. And in cats, it's the formation of urethra plugs or urine sediments getting stuck. So cats that have got issues like this, in relation to the previous topic that we talked about, your vets would typically recommend you to go on a diet that would encourage water intake or dissolution of stones or things like that. A prescription diet that basically in terms of urinary issue. Okay. So of course there are other reasons why they get blocked. Basically, you can have things like strips in the urethra. You can have a cancer or tumor or a mass around the bladder that's just compressing on the urethra itself. And the reason why this is considered an emergency is because with the buildup of urine in the bladder is under risk of rupturing, and of course, then that would that would not be nice. And the other thing is that urine can then track up to the kidney and cause kidney issues as well in that sense. And of course, this can result in severe complications. Yeah. And so it's always best that if you have got any suspicion that your pet is having any difficulty peeing, bring them to the vet. Yeah, and we can then investigate what is the reason, what's the cause of the blockage. Yeah.
So for that's for life, right?
Yes.
Do you all offer like maybe tele consultation over the phone just to make sure like it's a real emergency?
Yeah, so Vets for Life, the clinic that I'm looking for, basically we have 3 clinics around Singapore. One in Tanjong Katong, which actually offers 24-hour overnight monitoring service as well. So, for example, if we've got a very sick patient, it's an option for vets to refer cases there, and they'll be watched 24 hours overnight by nurses. And of course, the vets will also be on call. So, for example, if there's an emergency, then the vets will be notified, and of course, then your pet will be receiving the appropriate treatment. Okay. Yeah, we have 2 other clinics in Singapore. One's in River Valley. The other one is a new clinic in Beauty World.
Okay. So can people call in? Like especially right now, it might be difficult to travel.
With the restriction or from phase 1 post circuit breaker, we do offer sort of teleconsulting that if anybody has got any question, any queries, any concerns, they can always call in or they can always email us to basically, if there's any concern, basically, then they can call us. Okay. So let's move on to the last one that I'm going to talk about. Basically, it's something called GDV, gastric dilatation volvulus, and the most common sign typically noted by owner is the sudden distension or bloat of the stomach, and what people will typically notice is this unproductive retching or hypersalivation, and sometimes even collapse. And what happens in such cases is that the stomach is twisted and blocked at the entrance and the exit of the stomach. And as air build up and air and fluid build up in the stomach, basically the stomach can cause a compression on the returning vessels to the heart and cause issues in terms of cardiac output or the amount of blood that's getting pumped out by the heart, basically. When you bring pets that have got suspected bloat or GDV to the vets, then what the vets will do is that we do X-rays to differentiate between a simple bloat or a GDV, basically. But what we would advise you to do is that before you bring any pet that has got any bloat or GDV or suspected cases, then ring us so that we can prepare the X-rays, so that we can prepare, IV catheters or fluids and things like that, be ready when your pet arrives, so that we can quickly diagnose and render treatment as soon as possible. Yeah. So there's actually no single cause that has been pointed out why GDV happens, but it's believed that it's multifactorial, and deep-chested dogs or dogs with lean body condition score eat quickly or only eat one large meal a day, or have a nervous sort of temperament, then it can be more likely that they can have GDVs. But of course, as long as we are able to recognize the clinical signs, then we will be able to seek help quickly for our pets. So the more important thing is to know the clinical signs, what to look out for when you have got a GDV case. So with that, that's the part on emergency cases that we see in the clinic. Has anybody got any questions or?
Yes, I think there is one question. By Haley.
Okay.
So the first visible reaction to look out for if they ingest any of the toxic food.
Sorry, what was the question again? Would I be able to see the questions?
Yes. It's much earlier. Basically, like signs of them like food poisoning.
Okay. Food poisoning as in?
Maybe they eat something that they shouldn't eat.
Like toxins and things. Yeah, so again, if your pet has got any suspicion that your pet might have eaten chocolate, for example, then we would say, okay, give us a call, then we'll prepare the necessary things, and then basically, as long as we are within the time frame to actually induce vomiting, then we will induce vomiting. There are other more sort of options. There are more invasive options such as flushing the stomach and things like that. But of course, as long as we're still within the time frame, which typically is about 4 hours, or as long as your pet hasn't developed more serious complications with the toxins, then we're actually okay to induce vomiting. And ideally, we want to do that within the 4-hour period, basically. Yeah, but give us a call so that we can prepare whatever that's necessary first.
So within 4 hours.
Yes.
Okay.
Okay.
So another one is I think it's more on diet. The relation
between
the first heat and not eating well. By Kevin Teo.
Oh, okay. So dogs that are going to get their first hit or undergoing first hit, they will be a bit more lethargic than usual. They may be a little bit more picky as well. There's nothing that you need to change in terms of diet, but what you can do is give something more that smells nicer. Typically, fish smells a lot nicer, and would maybe entice them to eat a little bit more. But it is normal that they are a little bit more down with undergoing their first heat.
So by
Aldrina
on sterilization and food intake.
Okay, so I saw the question. So yes, body weight times 30 plus 70. The formula is a very is a general guideline. So what we would always advise you to do is that the input and the output has got to tally. That means to say that whatever you are trying to feed, there must be the amount of activity level that your dog or your cat is doing in order for them to burn all the calories off. So the best way to assess again is to look at the body condition score okay, maybe what we'll do is we'll post something on body condition score on the web page as well, and then you can have a look. But we want to briefly be able to feel the ribs, but also the backbone as well. So if you can't feel them on the ribs or the backbone, then your pet might be slightly overweight.
Okay.
Okay. Answer her question.
Yes, so I think we'll go to the last question by Simon. I think there's two parts to the question. First one is general thoughts around flea and tick treatment. And the annual vaccination.
Okay. So so external parasite control is really important. It's really important. Reason for that being there are diseases associated with a tick bite. For example, if the tick has carried diseases that can be passed on to your pets, then it can be really important that you put your pets onto these preventatives. The therapeutic dose or index of the products that you've mentioned, they're quite high, meaning to say that it's safe to use them. There will be odd cases that do not do well with any preventative. Some dogs will vomit, some dogs will have issues, even such as neurological signs and things like that. And we will then stop the preventative in those cases, of course. Then you've got to be a bit more careful in terms of preventing ticks or fleas or the other thing that we haven't talked about is heartworm, basically. And heartworm is also very important because it can cause heart diseases and of course then it can cause a lot of issues to your pets. The second part of the question talks about annual vaccination. So the guidelines, again, by WSAVA is that the main component of the vaccine. After puppyhood, you don't actually have to repeat on a yearly basis. What we would recommend you to do is you can do a titer test, antibody titer test, that will look at whether or not your pet has got sufficient antibodies in the body to protect him or her against the diseases that we vaccinate against. The other component of the vaccine is leptospirosis. That's quite important, though, that you have to vaccinate on a yearly basis, because that doesn't actually mount a good immune response from the body to create antibodies that will last for more than a year. So that's the component where we will say you still have to vaccinate every year.
Okay. So I think we have come to the end of this live stream. It would be available on our Facebook page. So you guys can just rewind and watch the part. Yeah, to Kevin who missed the answer.
Oh, was there a question that I missed?
No. He missed listening to your answer.
Oh, right. Okay. Okay. If anybody has got more questions or anything that you would like to know, then feel free to email us. Jane, can you put the email down in the comments later? Yeah, thanks. Yeah. Thanks for coming again. Everybody stay safe and stay healthy. Yeah, okay.
Okay, thank you so much, guys. And so sorry for the audio. The echo is quite bad. Yeah, but also thank you for sponsoring this session. Yes. Okay. Thank you, everyone. Bye.
Bye.